had talked about some of the elements here about fuel, accelerators, moderators, and brakes. So if we go to the next slide, just highlight this is what the learning health system accelerants, moderators, and brakes are. Having a cadre of patient-family caregivers through your patient-family council, or in Mississauga, it's the Community Activation Network, the Community Health Activation Network, so that CHAN, having people that are engaged and involved all the way along the way, having community partners that you're working with. These are fundamental supports to be able to do co-design. You can't just open up co-design and say, hey, we're going to invite a couple of people. No, you really need to have relationships and start and build that. And the investment that goes into creating those relationships, you want to sustain that over time. And it will really empower. All of these things are really about things that you will use to empower and accelerate your capabilities to make change happen. That's the purpose of the learning health system, is to make improvements and change happen. If we go right back to the very beginning, engaging with Indigenous groups, and I know that some OHTs are doing a really, really powerful. Some are led by Indigenous groups. Then other equity deserving groups also different. It's not the same. They're grouped here together. That's not to distinguish, but more about just how much space we had on the slide when we designed it. But different engagement strategies for different groups. That's our intention here in our thinking. The health workforce needs to be engaged. There needs to be a way and a process by which the health workforce and patient family caregivers understand the learning health system. And resources are being built now to create more knowledge translation. We have the summary, which I showed at the beginning, but also what are the specific messages and how do people get involved from the different angles. Then there are other infrastructures that really build a sustainable infrastructure for the organization to move forward. Having access to scientific expertise, having appropriate and dedicating appropriate funding to this work, having the data and technology insights, and in an ideal world, that data technology is population-based, integrated, and interoperable data systems. That's our ideal state. So how much are we building towards that? What e-health, m-health, tools are we actually starting to accelerate and align towards this work? The other piece around, building health system capacity, we're part of building health system capacity. This webinar is part of building health system capacity. Identifying change priorities, those are more external. The top fuel accelerants, we think, are a bit more things that OHTs build up themselves. And the bottom, these accelerators and moderators and brakes, are things that the system needs to support. Ensuring that laws and regulation enable the activity of the learning health system, ensuring that privacy enables the sharing of data, ensuring that governance and accountabilities are set to support this work. And I think also ensuring that ethics, which may be internal to organizations, but it's really about this line around quality improvement and ethics, and it's unethical not to make change happen. And so how do we ensure that as change happens, people have choice, and as data are collected for evaluation, that people are consented, and we're not doing things to people, we are doing things with people, and being supported by them. So there are so many things, but really these elements here are about the infrastructures and the supports to make this sustainable and scalable. You can do a project with just a bunch of people and some willing interests. But to really sustain, you need to start building in these infrastructures. And in fact, to my knowledge, the only program in the world, Victor actually comes from it, where we have a graduate degrees in learning health systems. It's actually about infrastructure and learning health systems, because it's so important to be able to actually sustain this and build it.